Welcome to Have More Babies. Today, we're digging into some really interesting source material that one of you, a listener, sent over. It's all about hepatitis B vaccination and this alternative idea called manual protection, what that really means for a family.
It's pretty compelling stuff because it really makes you face the practicalities. Before we jump in, maybe we should quickly clarify what HBV is, right?
Yeah.
Hepatitis B virus. It's a serious liver infection, spreads through blood, other body fluids. And crucially, these sources really stress that the virus can, survive outside the body on surfaces for a week, maybe longer.
Okay, and that fact seems to be the engine behind this whole graphic reality check the sources provide on manual protection.
Yeah.
So it's not just about, washing hands more often.
Not at all, no. Manual protection, as defined here, is, well, it's the parents thinking they can match the vaccine safety level just by stopping kids from sharing things and by meticulously trying to prevent any fluid exchange everywhere, all the time.
Wow, that sounds intense.
Exactly. And the sources argue trying that level of control isn't just inconvenient. It basically changes what childhood is. The vaccine, then, isn't just seen as medicine. It's framed as the key to having a normal, safe childhood. It removes what the authors call a constant minefield of risk.
Okay, let's unpack that minefield. Where do kids usually start interacting? Community settings, right?
Yeah.
We tend to think of HBV risks more in adult contexts, maybe. But these sources are zeroed in on childhood, toddlerhood even. So the big question, can an unvaccinated kid even go to daycare? The sources say yes, technically, but it's actively unsafe. Why is that?
Well, it boils down to a couple of things. The kid's age, for one, and how incredibly resilient this virus is. We're talking about 2-year-olds, they haven't quite mastered impulse control yet.
Right.
Toddlers bite. They scratch, they stick toys in their mouths, then hand them to the next kid. The sources actually say blood-to-blood contact in that setting is practically inevitable.
I get the closeness risk, but usually you think of viruses needing fresh fluids. Are these sources saying the contact doesn't have to be immediate?
That's the absolute key point they hammer home.
Yes, because HBV is so tough, so robust. It can stay infectious for days on a surface. Think about a dried speck of blood on a shared toy, or a scratch on a table.
Okay.
So the parent isn't just guarding against an injury happening right now, but potentially something from hours ago or yesterday, trying to manually guarantee the hygiene of every single surface, every object a toddler touches. It's just impossible.
So if inside with other toddlers is that risky, what about outside? Structured play? The sources mention playground specifically. What's the risk there? They talk about scrape-to-scrape contact.
Yeah, think about how playgrounds work, right? Kids run, they climb, they fall, collisions, little scrapes, bumps. It's just part of it. A kid gets a bloody nose, wipes it, touches the slide.
Then another kid, maybe with a tiny cut or a fresh scrape on their knee, grabs that same railing a minute later. The authors highlight this constant kind of low-level risk. Just proximity and minor injuries happening together. So manual protection means pulling the child out of any place where a scrape could possibly touch a contaminated surface or fluid.
Which means even just a quick trip to the park suddenly becomes this huge source of stress. And if the park is that difficult, then bigger gatherings.
Well, the sources say they're completely off limits, like birthday parties.
Exactly right. And the social cost there is huge. It's not just missing cake.
No.
It's missing the event. The whole environment. Birthday parties basically combine all the risk factors, don't they? Kids are excited, maybe a little roughhousing, sharing snacks, sitting close, passing toys around.
Yeah.
So the mandate for manual protection means missing those milestones. It leads to social isolation simply because the chance of a minor blood exchange during playtime is seen as too high. So the planned fun is out, spontaneous fun is out. And connecting this to the bigger picture, this avoidance isn't just about socializing, is it? It hits things crucial for development. Physical skills, teamwork.
Precisely. Think about physical growth. Team sports, categorized as unsafe. Kids collide. They scrape knees, elbows. They fall down all the time.
Right.
The sources point out how even small sports injuries like a cut lip in basketball or a dive in soccer that scrapes an elbow become clear exposure points for an unvaccinated child.
The sports risk seems kind of obvious, I guess, but this is where it got really interesting for me. The sources find risk even in places you'd think are calmer, more structured. They talk about spiritual settings posing a threat. Children's church, Sunday school. How?
It highlights something important about kids' activities, doesn't it? These places are designed for group work, close interaction. The risks they cite, things like shared craft tools, scissors, maybe glue sticks, markers, accidental paper cuts, or maybe blood from a nosebleed that got quickly wiped, then transferred to a shared object. So avoiding children's church isn't just avoiding a small risk. It means missing out on community, social learning, spiritual growth. Safety turns into forced segregation.
It feels like every single activity outside the home demands this impossible level of micromanagement over every object the child touches. Let's shift to intimacy risk then. Things like sleepovers. This brings personal items into the mix.
Yes, exactly. The focus shifts a bit here from the general environment to personal items that kids share, often without thinking. Things that don't get meticulously cleaned between uses. The sources mentioned shared bathrooms, obviously, but also toothbrush mix-ups that happen.
Oh, yeah.
Or shared grooming tools like nail clippers. Even if parents are sure their child doesn't have HPV, they have to operate as if any friend invited over could be an asymptomatic carrier. Suddenly, a simple sleepover becomes this potential high-risk event.
Okay, so we've covered the community playgrounds, parties, church, sports, sleepovers. It's all presented as this minefield, which forces the big question the sources seem to want us, the listeners, to really grapple with. If a parent does isolate their child, keeps them home, is home 100% safe? And the answer from these sources is a hard no.
That's probably the toughest realization in this research, yeah. Home isn't automatically safe because of the family itself.
Yeah.
We know HPV can be transmitted within a household, especially from an adult carrier to a child.
Right.
And carriers can be, silent and
Yep.
chronic. They might have no idea they're carrying the virus.
So even if the parents know their own status, what about like grandma visiting or relatives or even someone just coming into the home briefly, like a repair person? What are the risks inside the home that we might not think about?
The sources list common things. Shared grooming items are a big one. Razors, for instance.
All right.
Maybe used by a parent or an older sibling. Accidentally using it, or even just touching the handle if there's a microscopic drop of blood from shaving, that's a risk. Also, things like shared nail clippers, maybe emery boards, even some medical equipment if someone in the house uses it, like glucose monitors maybe,
Yeah.
if they're not cleaned perfectly.
Uh,
These things become silent risks. The amount of constant vigilance needed to police every single item in every bathroom, every shared space, it's just not compatible with normal family life, is it?
So putting it all together, what's the final word on the reality of manual protection? It sounds like it's not really achievable, more like a myth of total control.
That's exactly the conclusion, yes.
Yeah.
It argues that even the most dedicated attempt to control every environment is ultimately futile because accidents just happen. Scrapes, bites, cuts. The sources describe them as an unavoidable inherent part of childhood. So the material effectively argues that choosing not to vaccinate forces the parent into being this perpetual safety monitor, constantly tracking, sterilizing. And in doing so, they sacrifice the spontaneity, the richness, the very essence of being a kid. Unless that child is literally in a sterile bubble, completely isolated, manual protection is presented as impossible, unrealistic.
The final conclusion from the source material is really quite powerful then. It argues the HPV vaccine isn't primarily about preventing rare adult risks like specific behaviors. It's positioned as being about making normal childhood safe. The playgrounds, the craft time, the scraped knees. Without it, the implication is parents must deny kids the very experiences that help them grow, connect, and just thrive.
That really is the crux of it. The choice not to vaccinate, according to these sources, puts parents in this impossible spot. Isolation, constant worry, sacrificing core childhood experiences to try and manage risks that vaccination handles easily. It really makes you think, doesn't it? How many everyday childhood activities just fundamentally assume that basic public health protections, like vaccines, are already in place for everyone in that shared space?
Absolutely. Now, if this discussion was helpful and you're looking for more detailed medical information about hepatitis B vaccination, the risks involved, or maybe other important childhood health topics, we strongly, strongly encourage you to visit omegapediatric.com. That's a great place to find reliable resources and expert answers for these kinds of critical decisions.
And if this exploration helped you understand the practical side of this choice a bit better, maybe gave you a clearer picture, please do give us a like. Subscribe to the channel, too, for more curated insights like this, and maybe share this video with someone else who might find this reality check useful.
Until next time, keep exploring those complex topics. Goodbye for now.